23. When you turn left to go to your lounge, I'm the first door on the left because it's close to the clinic, and it's a small office, and I didn't have to share. Okay? So when you look here, find out when your schedule and my schedule intersect. You're going to come and visit me 2 at a time, once a week. Let's say it magically works Monday morning at 9 o'clock that your schedule is open. You'll come and sit, and I've got room for 2 of you at a time. You'll watch me do my work as I read the x-rays. Okay? And it gives you a bonus 10 extra points on your overall grade. Now you might think that's an awful lot, but over 500 points, it's not a whole lot in terms of percentage. It's not only going to shift your grade if you're at 89.8. That's enough to push you over, okay? But the experience with me, like they say, is, what does MasterCard say?
Hey.
Priceless, okay? We talked about the textbook projects. We've talked about film reading. That's how it happens. It doesn't matter to me which day of the week it is. It's your dedicated for U5S only, okay? We can take 2 at a time. I don't care how you organize it. If your time is Monday morning at 9 o'clock and nobody shows up, I keep doing my work. If one of you shows up, I keep doing my work, okay? And the other person that should have shown up, just, I can't give them the 5 points or whatever it is, all right? That's what I mean by film reading. And we'll do that, if you say, I don't need the points this semester, that's fine. Okay, we do that every semester until you graduate, no, up until semester 8, okay? What do I mean by the Instagram project? I've already touched on it, so I guess you're the dedicated young lady for Instagram?
Yes, sir.
Okay, so we'll roll out normal variants as we talk about them in class. So I'll probably give her cases of an LSTV on Thursday. She'll roll it out over the weekend. You can open it, you can look at it. Okay, why am I doing that? Because I want you to have more practice. I've been doing this a while. I know that the people didn't go to the PDF because on the examinations they didn't see what they needed to see. So the modular exams are 20 multiple choice questions, but 5 cases. And what are the cases all about? You interpreting the x-ray on your computer, and you'll handwrite it. It's not multiple choice, because life is not a multiple choice question. So the cases are examples of what I've shown you on the PDF, in class, or delivered via Instagram. Okay, and we'll talk about how we do all that. I just appreciate your help.
Okay.
Okay? All right. So that takes care of that. This is what I talked about, excused absences versus unexcused. Okay, I guess this is unexcused. If you have emergencies will happen, just let me know. Okay? If it's past the 7 days after, let's suppose you're not here because you had a family emergency today, if I don't hear from you in some way, shape, or form to my email by next Tuesday, if we did a project, I'm sorry, you're out of luck. Okay? Projects, I'll release them at lunchtime. We'll talk about it in class on Tuesday, and I may change this. I may change it to Thursday so you have the weekend to do it, and then you'd have a longer time frame. So that may change a little bit, and I'll make the adjustments to the syllabus on Blackboard. Okay. Ladies, we said this was what? Anatomic position. It's a standard that we've accepted in the medical and chiropractic world. This is my which hand? So if I use a marker, which marker should I use here?
Right.
Right. If I stand like this is still which hand?
Left.
Left. So I need a left marker here because that's the standard we've accepted. We mark according to anatomic position. Now, why do we need this fancy diagram? Because on a MRI, you can slice axially, you can slice coronally from front to back, and you can actually slice side to side, so 3 planes. And we're not going to go any faster than that. It's always plain film first, and then MRI at the end. Okay? So anatomic position. So now we're talking about cervical spine positioning. We're going to, on Thursday, practice anterior posterior open mouth, anterior posterior lower cervical, and the lateral. And every time we get together, we'll introduce more until we've got 7 views of the cervical spine. So these are the standard views. Obliques to visualize the IVF, and flexion and extension in the setting of car accidents. Do we have car accidents in South Florida?
Oh.
Yes, there's practices built on personal injury MVAs. That's when your head hits the steering wheel. If your head hits the steering wheel, we need a good AP open mouth. because the second cervical vertebrae, the odontoid, is at risk for developing fracture. Okay? Our colleagues in the field don't think we need an AP open mouth, they do, they just do a combination view and a lateral. And I'm saying, well, what happens if your patient in a car accident? Are you worried about an odontoid fracture? No, I haven't seen one. Well, with a good AP open mouth, haven't seen them because they walked into your office and walked out again because you didn't take the view that was designed to see that region optimally. Okay? And then I did this. What do you see from your perspective besides a black object? Let's do it with this then. What do you see? No, a pen. The minute I turn it at right angles, you see the clip. It's the same thing with this. Okay? You cannot see every fracture on the right angle view of the lateral. So these are standard views that are taught in the medical program across the street and in the chiropractic world. Okay? So we'll quickly go through those. We're covering what we did last week. So I told you, your patient can be getting ready for you. I want to get rid of metal objects, so we're x-raying the cervical spine. What metal objects do we want to get rid of?
Piercings,
Piercings where?
belly button,
Belly
nipples,
numbers.
tongue.
They're taking x-rays here.
Oh,
What?
earrings,
Earrings, good. What else?
tongue rings,
Tongue rings, good.
nose ring.
Nose rings, everything, okay? Now, don't make the mistake what I did. I had a patient came in and had a big patch over their eye. Of course, I have to know what's behind the patch. Okay, so take off the patch. There's bare bony orbit. This was prior to the invention of corneal implants.
Oh,
The only thing
man.
the patch did was make sure the dirt didn't get in there.
Mm.
So be careful what you wish for or ask for, but the idea is you want to get rid of metal objects, okay? And how long did this take? Just take my glasses off.
No time.
Okay? What do you think I see most commonly on a lateral cervical spine?
Glasses.
Glasses, because they don't care. I'll put in layman's terms, they don't give a, starts with S and starts with T. Okay?